Happy Nurses Week. I'm really glad that I could give you guys something like tangible for one of these sessions, like a little bit of TLC and a little bit of self-care with the oils, because I know how it is being a nurse. I know how it is being a mama. Happy Mother's Day to everybody tomorrow as well. And, you know, this is why I love coming on and sharing and teaching, because I've been there and I know that there's a lot of stress and anxiety and just like overwhelm. And, you know, I was even thinking even the physical pain that can come alongside our job as well. So, hopefully most of you guys received our little kind of care package. If you haven't, it might be because you're in another country and the mail only goes so faster than a week. But if you didn't, or if you weren't able to fill out our little form, feel free to touch base with me and I'm more than happy to get a little package out to you guys, because you all deserve it. You all work really hard. So Claudia, if you're ready, I have my little PowerPoint that I can share with everybody.
Yeah, that sounds great. Go ahead.
So you guys, I have to warn you, I am a talker, so I love having a visual PowerPoint to keep me on track. And I think it's just like a nice little presentation that can help you understand the basics. So I'm just gonna go for it and get ready to roll. So if somebody wants to give me a thumbs up, or Claudia, if you want to let me know if you can see this properly.
Yeah, that looks great.
We good? Okay, so this is it. So before I like jump right in, I think hopefully most of you guys have your little sort of packets of peppermint and wild orange. I really like to give people a hands-on experience. So if you don't have them kind of handy by your side, run and grab them really quickly while I'm chit-chatting, because we'll do a couple of really cool things kind of through this class. Hopefully I'll cover all of the basics, but I do kind of like to just make this an easy basic class for everybody, because some people have dabbled in oils before and others are completely brand new. So we kind of try and meet everybody in the middle. So this is Essential Oils Made Easy. All right, this might be a little bit delayed. Sorry, guys. The PowerPoint always seems to delay with Zoom. Here we are. So the goal of this class, like why do I teach people, why do I educate people, is really, when it comes down to it, to empower you. Because like, you know, a lot of you have mentioned you're caretakers in some regard, whether it's with your patients or your family or your children. And so my goal really in teaching people how to use essential oils is just to empower you. My really quick backstory, I actually got into them myself because of my son. So I have two little ones of my own. So I know how it is to be right kind of in the muck of there, the thick of it, I should say, but he didn't sleep. And so really long story short, we tried everything. So, I mean, we tried all of the over the counter, you know, medications that our pediatrician had recommended, thinking it was, you know, he just kind of needed to get back into, you know, his own rhythm. I mean, we tried sleep training. We were even overnight in the hospital with sleep studies because we didn't know what was going on. He was an actual insomniac. And like, lo and behold, in the end, it was literally a couple drops of lavender oil that got him sleeping. It was just able to soothe his nervous system. And that kind of just opened up this whole new world of alternatives for me personally. So this is now what I love to do, is just to share with others, and in particular healthcare practitioners, because again, we're under that burden and we're dealing with all of those ups and downs and emotions and, you know, our own chronic, you know, or acute ailments and concerns. So if I can teach you, you know, how to empower yourselves with just these little bottles of oil, then I've kind of done my job. So, you know, they're everywhere now. So whether it's nurse practitioners or PAs or RNs or chiros or acupuncturists, it's just really nice to have this kind of little toolkit that you can use to really take care of and support yourself and the people that you love. So we're gonna pretty much run through three things. We're gonna talk about three cool things about oils, three ways that you can use them. And then if anyone's like, holy moly, yeah, like how can I get my hands on them? I can show you guys afterwards. We can chat, we can connect, but I'll show you kind of the best way to go about doing that. So we're gonna dive right in. Is everybody ready?
Yeah.
Claudia,
Ready.
you're my go-to because I can't see people, so I'm just gonna go by your
We're ready.
thumbs up. So 3 cool things, okay, about essential oils. The first cool thing is that they're safe, okay? So essential oils are 100% natural and safe. So what this means is they're just pure 100% essential oil. So there's nothing added to them and there's nothing taken away, which means that there's no side effects. There's no risk of addiction or overdose, which we know can be a concern with some of our prescription or over-the-counter medication. So that's one thing about the oils, is they are totally safe. So really all essential oils are these extracts from plants that have these really incredible health benefits. And you know, honestly, before I was introduced to oils or knew anything about them, I was kind of into herbs and herbal remedies, and they're wonderful having herbs on hand. So a lot of people kind of ask me, well, what's the difference between using herbal remedies and using essential oils? And you know, there are a few, but one of the big things is that they're a lot more concentrated and potent than herbs. So you can see there, they're actually 50 to 70 times more powerful than herbs. So all we're needing is 1 or 2 drops to really be able to reap those therapeutic benefits. So just to give you guys kind of your first off oil experience, okay? You have your peppermint. So grab your, either might have come in a teeny tiny little sample, like a vial, or one of those sachets, okay? So you can kind of tear open the top if you haven't yet, or yes, exactly, Claudia's got it there, or you can unscrew the cap. So I'm gonna give you guys your first kind of wow experience with oils, and that's your peppermint oil. Now, before we do anything, and I'm gonna do it with you, okay? Because it's just super fun. Now, just to give you an idea of what that means, how powerful and potent these oils are, 1 drop, okay, of our peppermint oil is equivalent to drinking 28 cups of peppermint tea. So that's how potent they are. Okay, so we're gonna do this all together. So I can't see you. So I'm guessing you've got your peppermint oil, okay? So what I want you to do is either tap the bottom of that little vial or just kind of squeeze a drop of the peppermint oil into the palm of your hand. So I'm gonna do it with my bottle while you guys are doing it as well. All right. Next, what you're going to do is you're going to take your thumb of the opposite hand and you're going to press it into that little drop or puddle of peppermint oil. Okay, next step, we're going to actually press it to the roof of our mouths, just like this. Okay, and give it a little swipe. Then you're going to rub your hands together. All right, and without getting too close to your eyes, I want you to cup your hands around your nose and take some nice deep inhales for like a good 10 seconds. And just breathe it in. And then the last thing we're going to do with the peppermint is you're just going to go ahead and massage it into the back of your neck and your shoulders, okay? And once you've rubbed and massaged that in, you should feel a nice kind of cooling sensation. So that's peppermint oil. And 1 drop of it, okay? So you guys can see like how powerful just that 1 drop of peppermint is. Did you guys feel that? Like it just wakes me right up and I have this like instant energy. I love, love, love peppermint. So that's your little peppermint oil experience, okay? So you can see there down the bottom, exactly that. Peppermint is really energizing, okay? So say 3 or 4 o'clock in the afternoon rolls around, or you're like dragging out of bed first thing in the morning, just take, like what I say, a little hit of peppermint oil, right? It's got that instant energy. It promotes clear breathing. So if anyone's struggling with things like allergies, congestion, anything along here, you can see how quickly that peppermint can just open up those sinuses and those airways. And it's really cooling to the body. It's a natural coolant, okay? So You can feel that cooling sensation on your back. For those of you that do have kiddos, okay, or if somebody spikes a fever or a temperature, you can actually apply the peppermint oil to the back, bottoms of the feet, and it's going to naturally bring your temperature down a couple of degrees. So just a nice natural alternative to some of the other over-the-counters. And a lot of people are familiar with peppermint and headaches or head tension, right? So it almost instantaneously can kick that headache. So just a drop massaged along your hairline, temples, and the back of the neck is really, really nice to help relieve any of that tension there. And like actually somebody else mentioned, peppermint oil itself is great if you have any sort of like GI issues, nausea, post-op. It's great. Actually, it's used in hospitals all over the country, urinary retention even. So it's a really versatile oil. So that's peppermint essential oil. Did you guys like that? You can comment and chat, if you want as we go, so I can keep moving along, but that's one of my favorites. Something I want to mention, okay, you guys, is our kind of third little paragraph there. And that's something specific to doTERRA's oils. Now we have this standard of purity, and it's called certified pure therapeutic or tested grade. So the oils are not regulated. Okay. So what we've been able to do is actually create this standard of purity. So it means that the oils are both pure and potent. Okay. So pure, like I mentioned earlier, means that there's nothing added to the oils. There's nothing taken away. They're just pure essential oil. Okay. Now what potent, the potent part of that, what that means, and this is a really big deal when it comes to essential oils, is that all of the oils with doTERRA are actually sourced from their country of origin, okay? So that means that the plant that's growing is growing in its native soil and sunshine and rainfall. So the oil that that plant yields and is extracted is going to do exactly what we want it to do for our health. Does that make sense? All right, so that's called CPTG, you'll see it, and that's our standard of purity with the oils. So that's the first cool thing about essential oils is that they're safe. What I want to quickly do, and then we're going to come back to this slide, is just kind of really quickly show you guys how the oils, because we've mentioned this, are used to kind of bridge that gap between conventional and natural medicine. It's this more integrative approach. So I just thought this is really cool. I don't actually show this in all of my classes, but I like to with other healthcare practitioners because you guys might see them utilized in your workspace, your clinics, your own hospital. So this is a study done by Vanderbilt University, and it's really, really neat. It was actually done by a couple of charge nurses, Tanya McBride and Teresa Sturges, and they're working actually in the emergency department. And like the rest of us, obviously they were feeling that stress, the fatigue, and all of that overwhelm and kind of burden that can come in that kind of working environment. So what they did was they took this initiative to kind of try and create this more positive work environment by incorporating essential oils. So you can see where it's highlighted there. They went to the wellness committee and they actually approved the use of diffusing essential oils within the ER. And what's so cool is they surveyed all of the staff for 30 days. Okay, so it was pre and post implementation of diffusing the essential oils. And I'm in my own way here with this screen, but you can see the results off to the right, which I just think is so, so very cool. So the staff that were feeling that work-related stress before the use of oils, there were 41% of the staff that were feeling that stress very often. So after diffusing the oils, it was down to 3%, which is a pretty big gap. The staff that were feeling overwhelmed, there were 25% before the use of the oils, and after diffusing the oils, they were down to 2%, and so on and so forth. So, and then it goes on to say, the staff that felt equipped to handle the stress, only 13% were like, I guess I can keep up with this demand and I can deal with it. But after diffusing the oil, so it's that positivity and that influence, 58% of the staff felt that they were able to equip and handle those stressors that they were being exposed to in their daily work environment. And their energy levels even boosted. So beforehand, 33% of them felt like they had that optimal energy level. After diffusing the oils, it spiked up to 77%. So it's just a fun and really cool little way to see that the oils are used in many healthcare environments throughout. And so the whole goal really is just opening minds and seeing that if the possibility and the potential of using oils for healthcare workers is able to have such a massive and drastic influence, imagine what it can do for people within their own homes, and then therefore the trickle effect of how that's going to then influence those around them. So that's Vanderbilt University, which a lot of people are familiar with. And then what I thought would be cool too is just to pull a few PubMed articles for you guys. So these are all pulled off of PubMed, so evidence-based research articles, double-blind randomized studies, and there are just thousands of articles. So I kind of just had to pick and choose. But peppermint oil, obviously, somebody was mentioning this before, and nausea. So you could go ahead and kind of read the abstract, but primarily, the conclusion shows that peppermint essential oil, the inhalation has these beneficial effects on reducing nausea and vomiting after open heart surgery. So it's a pretty big deal. They're used in a lot of post-op, as we know, for managing that nausea and vomiting. So that's a study that was pulled. This is lavender essential oil. I just think this is so neat that they're able to really implement all of these. And again, this shows lavender and mood. Okay, so mood and emotional support. And we'll talk about this and how the oils can be really supportive in that regard. But just like it shows here, lavender was able to exhibit many desirable properties of an anxiolytic agent, including calming effect without sedation. So therefore, the dependence and the tolerance or the withdrawal is not going to be there with oils the way it could be with some of our other medications that are used, with these procedures. There's your lavender. Again, I don't want to go on and on, but just to give you guys some really cool examples. And Copaiba. So Copaiba essential oil is pain, inflammation. So these are huge issues that we're dealing with. Even things like respiratory support, immunity, and even again, your mood and your mental health. So this is Copaiba essential oil. That is demonstrating for the first time an in vitro immunomodulatory effect on the inflammatory mediators. So really, really cool, showing that it's a promising product for the treatment of these inflammatory diseases, for example, MS. So just a cool little tidbit of kind of nerdy studies for you guys, but I just wanted to show you how they are being used. It's all science, it's all chemistry, and we can use them to support ourselves and our patients. So just going back to that first slide there, is the second cool thing about essential oils, and that's that they're really effective. And I really like explaining this again to our workers in healthcare, because I think that you guys just get it. This just literally goes back to Bio 101. So to keep it really simple, okay, because sometimes it's the simple things that we need a refresher on. If you have a little look at this picture here, okay, that's an example of a cell within our body. So all of our cells, as we remember, are surrounded in this oily cell membrane, right? And that oily membrane is there to protect our cells. So more or less to kind of keep the good things in and the bad things out, all right? Now, there are two things that can be harmful to our cells. So the first are bacteria and the second are viruses, okay? Now, bacteria actually live just here. This little purple blob, that's an example. Bacteria live outside of our cells, and viruses live within, right? And duplicate our DNA. So I kind of like to give a couple of examples. So if anybody wants to shout out, feel free to shout out or participate. Say, for example, okay, you were to go to the doctor and you have some sort of a bacterial infection, okay? Now, a lot of you guys are NPs or you are practitioners. Like, what would you typically prescribe for a bacterial infection? There's so many chats in the chat box. All this, we'll go through this after. Does anyone want to?
Antibiotics, Spectrum, Macrobid.
Exactly. Yep. And people are saying, yeah, Melena's saying, yeah, an antibiotic, right? So that's great. We know that antibiotics are going to take care of that infection generally within, the typical 7 to 10 day window, right? But a lot of us also know, especially in holistic health, that antibiotics wreak a lot of damage on our gut health, which means our hormones and our immune system and our mood, right? Now, okay, what happens if somebody comes to you and they have a viral thing going on, a viral illness? What do we usually say to them then? Anyone want to chat? I know the answers to this. So you guys want to chat in?
Anyone else want to chime in?
Yeah, exactly. Sleep, fluids, resting, hydrating. Exactly. Right. They're like, yeah, good luck with that. Put your feet up, rest. There's nothing we can do. And we generally know the reason for this is because most recommendations that come right from our providers are water-based synthetic agents. And if we think about it, we all know that water and oils don't mix. Okay. So if we have a viral illness going on and we are given a water-based medication, that's going to have a really hard time penetrating that oily cell membrane to stop the duplication of that virus inside, right? But here's the thing, essential oils work a lot differently. They're oil-based. So if you were to use an essential oil, it's not only going to be able to combat the bacteria outside of our cells, but it's also going to be able to quite easily penetrate that oily cell membrane to stop the virus within, right? And without the side effects. And so that's why oftentimes you can use essential oils almost more effectively than modern approaches to health problems. Okay, so that's the second cool thing, is that the oils are really effective. This is really cool, this oil down the bottom, okay? It's called On Guard Essential Oil, and a lot of people that are familiar with doTERRA are familiar with this oil. It's our protective blend. So this is gonna be your immune support. Again, you can go on to PubMed and you will find all sorts of studies addressing the oils within this blend and showing that they are antibacterial, antiviral, antifungal. They've been proven effective against MRSA. So it's really, really cool to have an oil on hand that can be just as effective as some of our prescription or over-the-counters. So it's going to help to promote a nice, healthy immune system. If you're someone that struggles with sore throats, allergies, strep, anything like that, gargle a couple drops of your On Guard, swallow it, and odds are you're going to be good to go in the next 24 to 48 hours, which is pretty cool. And really, really cleansing just around the home, right? So natural without any of the chemicals, side effects, anything like that. So that's On Guard Essential Oil. And the third cool thing about the oils is they really are super cost effective. And, I really like to give the example. I have a daughter as well, a young daughter, and when she was young, she used to get a lot of ear infections over and over and over again. And, if I were to go to the doctor and bring her in, they're going to prescribe an antibiotic, right? And the antibiotic is then going to have the effects on her gut health. And I'm taking time, off of work and driving there and waiting and grabbing her probiotics. So it's this whole big ordeal. But what I could do after I learned about oils is I would literally go grab a drop of lavender, a drop of tea tree, rub it in front of her ear, behind her ear, put her to bed, and then 12 hours later, she's pain-free and asymptomatic. So pretty cool, because the oils are really affordable. They end up being pennies per dose. So, honestly, I've been so grateful just to have them for my own family personally. I mean, my husband was struggling with migraines and he rarely has them anymore. Again, we're using them for things like stress and just upset bellies with the kids and kind of everything. So it's just really nice to have them kind of in our back pocket when we need them. So you can see that's lavender oil there. So lavender, most people are familiar with. It's very soothing and calming to the mind. So stress, anxiety, depression, okay, just like you saw lavender with that PubMed study. Great to use for anyone struggling with any sort of mood or emotional ailments. So that's lavender. And what's really cool is if you think of it as a calming oil, it's not only calming for our mind and our mood, it's really calming for our skin. So again, it has these really, really nice regenerative properties. So if you have a burn, a bug bite, a rash, any sort of skin irritation, it's going to be really, really soothing to your skin as well. So that's lavender essential oil. And that's the third cool thing. Is everybody still with me?
Yep.
Yeah.
Everyone's all good. I love the thumbs up. I didn't know you can do that on Zoom. I'm gonna have to figure that out. That's awesome. Okay, so we're gonna move on if this doesn't freeze on me. Eventually we'll move on. I'm gonna try and skip past some of those articles. What's going on? I don't know if it's just me and my PowerPoints, but there's always a delay. Sorry, guys. Hang on. Oh, okay, here we go. It just needs a minute to catch up to me. I'm talking faster than it can keep up with. Okay, so we're gonna just breeze through 3 ways to use essential oils. So we just talked about 3 cool things. These are the 3 ways to use them. And a lot of people don't realize that you can use them so many different ways when it comes to these oils, okay? So the first way that you can use them that most people know is what we call aromatically. So smelling the oils, okay? So you can either diffuse them, which a lot of people know, okay, and the oils are going to be dispersed into the air and we're breathing them in. You can inhale them directly from the bottle itself. Or you can put them on your skin, okay? And you can inhale them that way. So they can positively affect our mood. They can help to cleanse the air, and they can be really supportive to our respiratory system. So I'm gonna give you guys another experience really quickly with the oils with your wild orange. So kind of grab that while I'm chatting. But I want to explain how the oils can actually affect our mood in a scientific and physiological way, because a lot of people think that it's kind of woo-woo, you know, and hocus pocus with essential oils. But again, it just comes back to the science, anatomy, and physiology. So if you imagine, again, for a moment, that say you have to go for some sort of dental procedure, right? So you go to the dentist and it's something minor, so they're not going to knock you out, but they might offer you some laughing gas, right? So they'll go ahead and pop the mask on and they'll ask you to take some nice deep inhales as you're breathing in those synthetic agents, right? And as we breathe them in, usually in less than 20, 30 seconds, you start to feel, you know, giddy, or maybe that, you know, feeling of euphoria or kind of silliness, right? So what's happening is, I can't see you guys, so I'm going to trust that you're doing this with me so I don't look silly by myself. But if you kind of take your 2 fingers here, okay, and you pinch the bridge of your nose just here. So behind my 2 fingers is something called our olfactory nerve. Now, our olfactory nerve is actually connected to our limbic system. So if you guys remember, our limbic system is our mood, our seat of emotion, it's our memory, okay? So as you're breathing in those synthetic agents, it's triggering the olfactory nerve and then your limbic system, and it's signaling the rest of your body and telling it what to do. So essential oils work the exact same way, right? But we're breathing in these natural compounds. And that's actually the quickest way to access your brain, is by breathing in those natural compounds. So for example, your wild orange, okay? So grab your wild orange. I'm going to do this with you guys again. So wild orange is really uplifting, energizing, invigorating. It's our happy oil, right? So Claudia, again, has a little sachet. You can tear the top, and just like with the peppermint, you can just put a bit on your hand, or if you have a vial, you can tap it into the palm of your hand. And I'm gonna have you guys breathe this in, okay? This is like our sunshine in a bottle. It's one of my favorites. So once you have that little puddle in your hand, just go ahead and rub your hands together. Okay, and then just cup your nose and take some nice deep breaths. Isn't that awesome? That's wild orange. I love that. I tell people, I'm like, try not to smile while you're breathing in wild orange. It's like impossible.
Yeah, it just is such a beautiful smell.
Don't you guys love that? So what's happening is we're breathing in those compounds, the wild orange. It's hitting our olfactory nerve, it's triggering our limbic system, and it's boosting our mood. So that's how the oils actually work aromatically. So we can directly influence how we're feeling just by using the essential oil. So that one's called wild orange. That's one of my favorites. So that's the first way, is aromatically. Okay. Someone's chatted. I have to see if people are loving this wild orange. Let's see what they said. Yeah. Nice big heart. I love that. Yeah. Wild orange is one of my favorites. So that's aromatically. The second way to use the oils is topically. So I pretty much just say, put it where you need it. Okay. So a lot of you guys got deep blue. So if anybody was saying that their top health concern was pain and inflammation, migraines, headaches, arthritis, whatever it might be, you would have received that sample of deep blue. That one is amazing. It's a game changer. So topically means just apply to the affected area. Yeah, Claudia's got, I love it. You're like my Vanna White, right? So that's your deep blue, okay, pain and inflammation. So if your hips hurt, put the oils there. If your lower back hurts after you've like hauled around patients and you're, pulling, pushing, turning, put the oil on your lower back. If you have a headache, put it on your head. If your stomach's really bothering you, put it on your belly, okay? If it's something general like you're struggling with sleep, so that sleep was a big one for some of you guys, or stress, anxiety, you can apply the oils to your pulse points and they're going to absorb topically like anything else, any sort of cream, steroid, they're going to absorb topically into your skin and going to be able to have those nice benefits throughout. You can also put them on the bottoms of your feet. So a lot of people are like, on the bottoms of my feet. Well, the reason is the bottoms of our feet. Okay. And I love this. So yeah, so as a massage therapist, this would be huge for you. Okay, the deep blue is amazing. We have a lot of practitioners using the deep blue, but the bottoms of the feet as well. So reflexology, massage, or anyone can use them. The bottoms of our feet have really large pores and nerve endings. So when we put the oils there, they absorb really quickly into our bloodstream, and we're able to actually use trigger points too. So for sleep, you can put them on the bottoms of your feet. Immune support, stress, anxiety, whatever it might be, bottoms of the feet is a great place, or even just your spine. So topically is the second way you can use them. We do oftentimes recommend that you use them with what we refer to as a carrier oil. So you're going to dilute your oils down, because remember, they're so concentrated, they're so potent. All you need is 1 or 2 drops, but you're going to benefit by diluting them down and recover more area, and also to help the oils absorb into the skin. So some of you received those rollers. Those are actually diluted with fractionated coconut oil, which is that brown bottle you can see there. It's just a liquid form of coconut oil. It's going to help the oils to absorb into your skin and just dilute them in case anyone has sensitive skin. So babies and elderly, you always want to dilute your oils. So that's the deep blue oil, okay, that you can use topically, or any of the others that you guys received. And then the third way that you can use the oils is internally. And I have to say, and I always make sure that I mention this outright, when I'm speaking about using oils internally, I am speaking specifically to doTERRA. The oils have been tested. We know that there is nothing other than pure essential oil in the bottles. So our oils are not only safe to take internally, they're actually recommended for their medicinal use. Okay, so when you're taking an oil internally, you can do it a few different ways. You can pop a few drops in your water for the day, or your water bottle, as long as it's glass or stainless steel. You can put it in your coffee. Some people like peppermint in their coffee. You can put them directly under your tongue, like we would say sublingually, right? Quickest way to get it in to your system. Or what's really cool is if you don't like the taste of an oil, or you're making your own kind of like natural concoction, you can put them into these little veggie caps, and there's a picture on there as well. And what's so cool is you can make your own natural medicine. So they're just these, I don't know if you guys can see them, these veggie caps. Okay, they look like plastic, but they're vegetables. And you just open them up and you put in any oils that you'd like. You close it, and then you take it like anything else you would over the counter. Okay, so that's the third way, is internally. Lemon oil is there just as an example of an internal oil. Lemon is really, really cleansing. Okay, so using a couple drops of lemon first thing in the morning, with some nice warm water is just going to help to set up your gut for a nice healthy day. Okay, so lemon, warm water, first thing in the morning, and it's going to help not only to cleanse and detox, but to help support all of those internal organs as well. And what's cool is you can take them internally, but just like it says down the bottom as well, you can use them in your home. So like you can literally clean your windows with lemon oil. You can use it as a natural disinfectant on your tabletop. So all different ways that we can use the oils, but those are the 3 ways. Okay, so that's the 3rd way, is internally. Yes, great way to activate your digestive system in the morning. Yep, absolutely. That's a really nice, simple, quick habit that you can do to start your day off on the right foot. And, you know, I always feel like if I can do that one thing, it sets me up to make good choices through the rest of the day. Let me see what I've got next. Again, I'm talking faster than my slides want to move. So what I want to do is there's just a few other really quick oils I want to show you guys if this decides to keep up with me, that are really, really helpful and kind of some of like the top oils that people find supportive through the day. So Digest Zen. This is a really big one. And actually, I'm going to, in just a couple of minutes, I would love to hear from you guys. And I was just going to say, Jamie, who introduced herself at the start, you know, one of my colleagues, I know that she's found Digestion is like a game changer for people coming in and out of her practice. So this is our digestive blend. Okay. So just think anything GI. Okay. So nausea, you know, IBS, vomiting, Crohn's, reflux is huge, okay, for digestion. So you can see here these little indicators at the top. Again, goes through the 3 ways that this oil can be used. So you could diffuse or just inhale this oil. So my son gets sick in the car. He gets a bit car sick. So I literally have him just literally take the bottle and smell it. And it's instantaneous. His nausea is gone from being in the car. If my daughter has an upset belly, if my husband's got reflux, if I've had a big meal, lactose intolerance, whatever it might be, you can use the oils. So aromatically, you could rub it directly on your belly topically, or you can just do a couple drops under your tongue or in a glass of water, and that's going to help to soothe any sort of digestive discomfort that you might be feeling. So that's Digestion. That one's a really big one. Frankincense, I wanted to mention because this is absolutely massive. So when we're looking at anything, yeah, yeah, nauseous on road trips as a kid. Yep, I know. I think probably all of us. So that's probably because at that point we were all riding like backwards in the car with our parents, right? Rules are much different these days. So, and I'm one of 6 kids, so I can attest to that. So frankincense is huge, okay, for pretty much everything. This dates back, for those of you that are familiar with the story of the Christ child, it dates way back when. Frankincense, gold, and myrrh, right? I mean, Hippocrates was using these, you know, as plant extracts. So frankincense is everything from brain health, okay, to immune system. So we're talking like memory, and it's even proven to cause, or I should say support, however you would phrase that, apoptosis of certain cells that are incredibly unhealthy for us to have within our body. Saying that in a very compliant way. So that's frankincense essential oil. And because of the small molecular size of this specific oil, it is able to actually cross the blood-brain barrier. So for those of us that are struggling with any sort of mental health or memory, or some of our older patients could really benefit not only from using the frankincense aromatically, applying to the back of the neck, brainstem area, or for those that are comfortable taking a drop under the tongue. Again, incredibly beneficial. So that's frankincense essential oil. Franken lavender in my diffuser. Yep, favorite Zen combo. I love it. Yeah, it's huge for meditation, for yoga, Reiki, you know, all of those more energetic and vibrational. It's incredibly high on vibrational frequencies. For those of you that are familiar with that, frankincense oil. And then I think the last one I had was adaptive. So this is a really cool blend, and I threw it up there because a lot of you guys received this in your little care package. This is all things Mood, emotion, focus. Okay, so this is one of our newer blends. Brown University is doing their own studies on it. It's a blend of oils that's just going to help to ease those nervous feelings. If you have somebody that has, if you're one of those people, the racing mind and you can't stop and it's hard to realign and focus and center, Adaptive is going to be a great, great oil and blend for you. You can just inhale it. Yep, Claudia's got it. Calm the heart, calm the mind, apply to pulse points. It's great for those of you that are into other holistic practices to apply before or after your sessions. Yay, hi, Tony. I didn't know you were on here. Yeah. Tony says that Adaptive Roller is her best friend at work. Yep. Oh, good. And helped you guys sleep last night after a terrible shift. Oh. So that's what the oils are for, right? Like we can come home to them or we can have them in our back pocket or our front pack and sneak them to our patients. But the oils are amazing, for that support. Okay. So, oh, I lied. There's one more because this one is great and you guys have to know about it. It's Copaiba. This is pain, inflammation. Remember that was the article, the research study that was on it. This is huge. This is an oil that we source from Brazil. It actually comes from the resin of a tree. So it's going to have a lot of similar benefits as CBD oil, but without the THC. So there's no risk or worries of any sort of THC or psychoactive effects, but you're going to have those nice same soothing benefits. So pain, inflammation, sleep, it's huge. If you have trouble sleeping, a couple drops under the tongue knocks me out. It just calms the entire nervous system. So I like to apply it if I'm having any sort of muscular or joint pain. If I'm having trouble sleeping, it's great for immune support. So kind of all of the things. Copaiba is a wonderful oil. And then the last thing that I always mention, and everyone's like, wait a second, you've got something other than oils. The cool thing with doTERRA, it's like a whole lifestyle. And for me personally, honestly, when I first got into them, it just opened up this whole new world for me. Like I had no idea really what was out there until I was introduced to the oils. So, something that we have alongside the oils, and it's actually the #1 product of everything, is this little trio of vitamins, and it's called Lifelong Vitality. And if you kind of enter into the doTERRA world and community, you'll see it all the time because it's such a game changer for people when it comes to things like energy, mood, sleep, focus, hormones, kind of like all of the things. It's incredible. And people notice a really drastic difference, pain, inflammation. So if you guys are like, I just need something, to kind of meet that foundation of health so that everything else kind of stacks up, like this is going to be your best friend. That's called Lifelong Vitality. And so, this kind of, is wrapping up our trying to take notes, but going so fast. We'll be in touch, you guys. I'm 100% here for you. I know you're only going to retain like probably 10% of what I just said, but this is what's really cool is I like to kind of put it out there to you guys after all of this, because that's a lot of information, but it's kind of, if it was like, if you guys were like me for the first time, like this, wow, and kind of this epiphany that there are options. And so I say, like, what are your top 3 health concerns? Like, what do you guys have, going on that's, either big or little or comes and goes, whatever it might be. Like, just imagine your life without those ailments, because it's possible if you have something to support yourself and that you can literally reach for whenever you need it. I mean, they're incredible, these little bottles, and it's just plant-based medicine. We go back to kind of mother earth. And so in saying that, because a lot of people ask, just like this, in the chat box, like, what am I going to do? You guys can text me. So we've connected, a lot of us already. But if you don't have my number, or if you didn't get a chance, because I know, Claudia, a lot of people didn't get a chance to fill out that form before, our cutoff, only because we wanted to make sure you got your oils, just text me, email me, we can connect. I'm more than happy to help you guys, moving forward, whether you're interested for personal use and support, or if you're looking to integrate them with your patients in your clinics, your practice, whatever it might be, that's what I do. That's what we do. So this is my number. I wouldn't mind, Claudia, if we have like 2 minutes, just kind of opening it up to you guys. If anybody wants to share your own experiences, if you've had a chance to try the oils in the few days that you've had them, or if you're familiar with the oils themselves. I'm done talking. It's your turn. Share with us.
Yeah, we can do that. There were some questions in the chat, also some comments. How is peppermint used for urinary retention? And Jamie was saying you can actually put a few drops of peppermint into the toilet, and the vapor will contact the perineum to increase urine flow.
Yep. So you think again, you know, when they're the oils, we say what they call, like, they flash off or they evaporate relatively quickly. So even though you're putting them in the toilet, literally they are molecular compounds that are going to be rising up. So in whichever 3 ways you decide to use them, you're going to be able to reap the benefits. Thanks, Jamie, for covering that.
And then someone asked which oil to use for stress and anxiety, and it sounds like the adaptive would be good, and wild orange.
Yeah, Claudia, see, you could do this with me. So adaptive, wild orange, balance, Copaiba. So the cool thing, you guys, with the oils, which I think makes total sense, is they're just like medicine. So if you were to go to your practitioner and your provider and you said, I am totally stressed out, like, what do you have for me? And they were to write you a script, and you went home and you took it and it didn't work, or, you know, it didn't quite have the effect that you were looking for, you're not going to just be like, well, that's it. You know, medicine doesn't work. You just go back and you try something else, or you bump up the dose. So the oils work the exact same way. So yes, adaptive and lavender and balance and wild orange are incredibly calming, and they tend to be our go-tos. But we always kind of keep an open mind and have a bit of patience when we're trying to find that magic combo.
I'd love to share just how I use them, because I've been using them for like over 6 years. I have 3 little kids. We use everything. I've just found that it's so empowering as a mom to be able to be like, oh, you have a bellyache, here's your oil, or, you know, putting them on before bed and getting them good night's sleep. So it's just been for us, just having them as kind of my medicine cabinet for my kids. And then, as Marilyn mentioned, like, as a practice, so I'm a PA and I work in primary care, and just being able to offer my patients a more natural approach. I mean, you guys have probably had similar situations where people have come in and they've been on Prilosec for like 3 years or 5 years, and their gut's a mess, and you know, they go to GI and they've been scoped and nothing's wrong, and just keep on your Prilosec. And so it's just so nice to bridge that gap and really be able to offer that. So for me, I've been able to really have a lot of success for patients, just using Digestin and weaning them off PPIs and really helping them heal their gut. But it's really been a game changer as well, just really having the natural options and giving them safer, more effective products, you know, instead of always writing a script.
Yeah, 100%. And I mean, it's what's really cool is I just think that, you know, obviously all of you know, because you're here with mindful nurses, like, there's this massive wave that's happening in healthcare, and it's going in a completely different direction. And, you know, I feel fortunate to be on board and to be able to do this. So, I mean, it's really cool, just as people are incorporating yoga and Reiki and meditation and, you know, and sound healing and everything into their practice, the oils are there too. So we've got a ton of practitioners that are able to, you know, be able, like I've said, to bridge that gap. So if a patient sees them once, or a client sees them one time, you know, and they're treated, or they're, you know, they're helped, or within that session themselves, they can still go home with an oil. So in that week or 2 weeks or 4-week period, when they are not able to go back, or they're not yet ready to go back to see your practitioner, they have the oils. So they can actually, that's why they're so empowering. They can bridge that gap. So it's really, really cool. They can be used really in any practice, in any regard.
Okay. And well, Tony was also mentioning expanding out to not just humans. She puts lavender in her diffuser when she leaves her dog at home. That's a great idea as well, with anxious pets waiting for their the owners to come
Yeah.
home.
Yeah, I love it. Tony was on our I love Tony. Tony was on our last class, and I know she's a big oil fairy, as I like to say now, and that's absolutely right. You can use them, yep, for your animals as well. So obviously there's safety behind using the oils with your pets, but that's something that we're able to help you guys out with, you know, educating and giving you some guidelines so that you're comfortable using the oils appropriately. Yeah.
All right.
Does anybody else have any questions? There's a couple new. I'm so happy. You guys are very welcome. I love doing this. I absolutely love it. It just makes me happy to be able to share the oils and to really educate and kind of, you know, get the education out there, because you know, it's not always there at our fingertips. And sometimes when we Google things, or, you know, or we haven't had the opportunity to attend a proper class, you know, it can be confusing and we don't really know where to go with our oils. So you know, I'm happy to connect with anybody that wants to connect and, you know, help you out, answer questions, whatever it might be.
Thank you so much, Marilyn. This is a wonderful class, also great information and like scientific articles to back up some of these this information. So that's wonderful. Thank you so much. And thank you everyone for joining. And happy Nurses Week. Happy early Mother's Day for mothers out there tomorrow. Tomorrow we're having yin yoga, sound healing, and breath work. Same time and same place. If you guys can join us, it's going to be a really nice, relaxing session. I'm going to be leading that along with the other co-founder, Janelle Smith. So I hope you guys can join us, or for the other parts of the week as well. And thank you, and have a good evening or day wherever you are.
Thank you so much. Yeah, thanks everybody.
Bye.
For a good weekend. Bye-bye.
Thank you.
Bye-bye.